come on in, have a seat. I'm Dr. Graham.
Please don't do that.
When I was poorly.
Please don't do it. Please don't.
What's the matter, darling? You're not having an injection, see? See? The doctor says you're not going to have an injection, OK?
All right. How can I help?
Injections. Come on, he's got ongoing health issues.
Yeah.
He's on methotrexate.
Yes.
Friday will be week 8 of the methotrexate.
Yeah.
2 weeks ago, some of his blood tests came back with bad kidney function. His creatinine levels were 78.
Yeah.
His baseline is 30. So they took us in the test. So anyway, for the past 3 days, he hasn't really eaten. He's very tired and he's not himself at all.
Okay.
So I'm quite worried.
And he's on the methotrexate for his skin, is that right?
I want to go home.
I know.
Darling. No. You're so brave.
36.7, so that's normal.
We'll go home.
And I'm just going to listen to your heart to count your heartbeats.
Stethoscope. Honey, there's not going to be any injection, OK? You're not going to have an injection.
I don't want the blood test.
I know you don't. If he needs one of those, can you not tell him?
Kimani is on methotrexate, which is a drug that requires regular monitoring to make sure it doesn't damage your kidneys or your liver. So he has to have regular blood tests for that. He has a number of other medical conditions, which means he has to go to hospital very often to see different consultants. This has made him very scared of going to hospital and why he is particularly scared of needles.
I know you don't like blood tests, my darling, I know. OK, let's test. Sometimes we just have to check them.
I'm just going to count your heartbeats, that's all, OK?
Listen to your heart.
So it goes.
It's a bit cold. You're so brave. You're brave like a superhero. Yeah.
OK, that's fine.
I don't want to be here.
I think he probably needs to go and get some you-know-whats done. Because of the other issues, because the tablet he's on can bring down his white count, which makes it more difficult for him to fight infection, so we need to know what that is. But the fact that he keeps wanting to go to sleep, you know, and he's not eating, he's not drinking very much, and yeah, exactly, so all signs that things aren't right.
I don't want to be here.
So is there any way they could do them here? Does that have to be at the Children's Hospital?
I don't want to stay here.
We won't.
I think he needs to go to the hospital, he needs to go to A&E. Because we need to get on with working out what the matter is, OK? I mean, we can do the urine here, but... No, we used to, but we used to have 2 nurses that were paediatric trained, but we don't anymore. So the under 5s, we don't do even routinely. What you can ring whilst you can go home and get the sample done, put it in a pot, yeah? Ring Dr. Mahan and see what he says. And he may say, I'll see you this afternoon. I don't know. But I'm not sure how much of the problem is to do with a urine infection or not. All right, I'm going to give you a letter, OK? Which nursery are you at?
What nursery do you go to?
I don't know.
Do you like your nursery?
What do you like to play?
Nothing.
Do you like to play superheroes? Not today. Can I be Thor? Oh, don't you want to play with me?
I want to go home.
We are. I'm just getting this letter.
OK, but you may need to go
I guess we
to
probably do need
ED.
some more.
Yeah. All right.
Do
Do you want me to put that in your bag? Yep. Oh, you poor little thing. Hey.
So can you get to the doctor?
OK, there you are.
Good boy. Should we go right home?
That sounds like a good idea.
Let's do that.
OK.
Thank you.
That's OK, bye-bye.
Hi there.
Hi.
Okay. I wondered if you wouldn't be coming because I saw that the little one had been off to hospital?
Yeah,
is that
on
right?
Monday. Yeah,
Yeah.
he was. Yeah, but I think
He's bounced
it was
back,
just
has he?
precautionary. Yeah, just in case
okay,
he's little.
Yeah, OK, all right.
Yeah.
So you enjoying being a mum?
Yeah, I think it's quite challenging.
Yeah.
Just because I obviously don't really know what I'm doing, and what I was saying to my husband yesterday, in the day I don't know if I should be doing more for him, because either he's eating, sleeping or crying, wanting to be fed. I don't know if there's anything I should be doing to stimulate him.
What more could you do?
Well, I don't know. There's times where I just think, OK, you're awake now, what should I be doing?
Just, I mean, interact and
Yeah.
do as much. You just grasp those moments and do what you can, really. And then, yeah. I mean, the time will come when you've got a little bit more time. But so you went into hospital on Monday.
They just observed him and then they sent us home again. So
OK. Has his breathing gone back to normal? It looks OK to me.
yeah, he's definitely breathing a lot better.
Apart from having been in hospital, do you have any other concerns about him?
Only just about his head, actually.
Yeah?
We've noticed that his ear on one side is further forward than the other. We asked about it at the hospital on Monday and they just said it is because he is leaning on one side more than the other.
OK.
And he's flattened his head.
So they were relaxed about it and said it was...
Yeah, they had a good feel of his skull and said nothing seemed abnormal, but
Yeah.
it said they said it was worth mentioning to you when I saw you.
Is he smiling?
He'll smile just really randomly, it doesn't look like it's a result of something that we've done. He just seems to smile.
He's 6 weeks and 1 day, so it's a bit...
Yeah.
It's right on the borderline, isn't it?
Yeah.
You happy with his eyesight?
He's definitely tracking us when we move around, and he does look at things that are making noise, but not all of the time.
No.
Okay. So I wonder about his eyes.
Do you want to get him out of there?
Yeah.
And I'll have him up on the couch to examine him.
Oh, yeah.
So, you're absolutely right about the ears. One appears to be further forward than the other. And I'm sure the hospital is right. It's because of this asymmetry of the skull, OK? Which is a common thing. And I imagine that this is just going to settle itself down over the next 2, 3, 4 months, actually. We'll have him back and have another look at that.
Yeah, that'd be good.
It's extraordinarily uncommon that we need to do anything about this. So what we're doing here, this is obviously not a full eye check, but what I'm doing is just checking I can see down to the back of the retina.
Oh, it's okay.
You're a wiggly boy, aren't you?
Oh.
So, eyes are moving, they seem to be moving together.
Yeah.
Pupils are the same size, and there's a clear view down to the back, so we don't think there's anything like a congenital cataract that would be obstructing vision there.
OK.
OK.
You find your thumb again.
Hey, Ralphie. Hello.
Doing a fake crying now.
Yes, you are, aren't you? Let's just have a look at your spine. It's a nice mobile spine. OK, lovely. Dress him up. I'm just going to jot a couple of notes down while I remember them.
It's OK. There we go. It's all done.
He's a lovely boy, isn't he?
Yeah. When he's calm.
When he's calm.
Yeah.
It's always nice when they're calm, isn't it? And listen, I should see him again, all right? Need to check that he's smiling properly, which almost certainly will go with following with his eyes as well. Those two things tend to go together. So if you can book an appointment for him to see me in 1 to 2 weeks.
Okay.
All right, Alfie, time to go.
Your chair. Uh-oh, chair time. Let's see how we go. Thank you.
OK, you're all right.
Yeah,
Let me do
got
the
it.
jaw, because it's quite heavy.
Thank you very much. See you
So
again.
you book that appointment on the way out.
Yes, I will
OK,
do. Thank
cheers then.
you.
Bye-bye.
And your grandmother?
Yeah,
Yeah?
yeah.
OK. And Polly's how old now?
Coming at 4 months.
Yeah. And how can I help?
She's worried about her eyes. This eye, she'll open it really, really big and it looks bulbous.
OK.
And you can see all the white right the way round it, and sometimes the eyeball will sort of tremor a little bit.
And how long has Mum noticed this being a problem?
Well, when she was born, she had quite bulbous eyes. You know?
OK.
They were quite thin, but they settled down. We put it down to pressure and what have you, but about the last month,
About the
6
last
weeks,
month.
that she thought it was settled, but it haven't, and it's like a bit worrying.
And is there anything else that's happening at that time? Is any other limb shaking or anything like that?
Not that I've noticed.
OK, all right. And how's she fed at the moment? Is she bottle fed or breast?
Bottle, yeah.
And she's taking all the bottle
Oh,
feeds?
yeah, she's a greedy moo.
And nappies are all OK? Is it
Yeah.
both the eyes or the right eye?
It tends to be the right eye, but
Okay.
the left eye does it, but not very often. It's more the right one,
Okay.
and sometimes it's squint right in.
Okay. And is there any family history of any eye problems?
I've got eye problems myself.
Any squints in the family?
Yeah, I had bad squints. I had surgery on them.
Okay.
Yeah, she's just generally worried about it.
All right. So let's have a look at Polly. If you pop her out and bring her onto the couch there, I'm just going to wash my hands before checking her. And no vomiting or anything like that?
No, nothing.
Okay, so if you pop her up here. And no discharge from the eye?
No, none.
No. No, let's just have a shine a light in here. You're very cute, aren't you? We've got the eyelid on the right just seems a little bit lower compared to the left. And there might be a slight inturning of the right eye. Fine, and apart from that, she's absolutely fine in herself.
Yeah, yeah.
Fine, okay. Pop her up and let's have a look at her while she's sitting in your lap as well. That would be helpful.
Come on, love. Come.
Let's just have a look here. So what I'm going to do is get what's called an orthoptist or somebody at the eye hospital who specialises in checking children's eyes in a bit more detail.
Yeah.
Is that okay? The letter should come through fairly quickly.
Oh, good.
So you've got her all day, have you?
Yeah, Mum's gone to work.
Right.
Gone back to work already.
Take care.
Thank you very much.
Bye-bye.
Thank you, bye-bye.
Hello. Hello. What can I do for you today?
Well, it's kind of a follow-up appointment about Louis' heart. He gets a racing heart every now and again. There's no kind of set pattern to it, it just happens. And I was asked to take his pulse when it happened, because we found it was about 80 normally, and it does double. And I've also got another concern. I'm worried about his sleeping. He seems to gasp a lot. Well,
Just like that?
yeah.
Oh, okay.
He stops breathing for a while and then does a huge gasp.
hold my breath myself.
Yes. You do when you're asleep. I think it worries me more now because I counted how long.
Yeah.
And it was 12 seconds he held his breath one night.
And does he snore a lot at night?
Yes. We call him Darth Vader as well.
I feel like
That's a pretty good Darth Vader impression. Excellent. All right. And how long have you been worried about his breathing overnight?
Especially worried probably the last 2 months. He's very fitful in his sleep. He'll toss around and wake up a little bit and go back. And some days he's quite tired.
Bless you.
Yeah.
Do you ever get sleepy at school? No. You don't fall asleep in lessons?
No.
Or anything along those
I
lines?
wish.
Oh, really? And have you had any thoughts about what you think might be going on?
Maybe I was worried about sleep apnea, but I mean, when I was a child, I had a similar thing, and I think I had an operation when I was little.
So I think that you're probably on the money there, Mum, in terms of what's going on.
Yeah.
I think it's your lymph nodes that you fight infection in your neck. You've also got some in your throat as well.
Yeah.
And sometimes they're a little bit bigger in children than they are in adults. And in general, they get smaller over time.
Right.
As they go into their teenage years. And in terms of operations and things like that, they only really think about those if they're causing a lot of bother.
Okay.
Should we have a listen to your chest? Okie dokie. So I'm just going to pop down the top if that's okay, and I want you to take some really big deep breaths through your mouth if that's okay. Well done. So that sounds nice and normal. So I'll just check your pulse rate. Perfect. Now, how big can you open your mouth and how far can you stick out your tongue? Cool, blimey. So you do have quite big tonsils. So, absolutely happy to refer. In terms of examining him today, he examines completely normally, but I do hear exactly what you're saying about his heart rate being very quick during these episodes. So again, I'm going to sort of make a doctor edge.
What I'm thinking is if he was an adult, we'd do an ECG here.
Yeah.
And I'm not sure whether we'd do an ECG at his age, just because I'm not sure we'd interpret it.
Well, that's the thing, is the difficulty with interpreting, isn't it?
So I don't know whether... I mean, I'm sure the Children's Hospital offers a means of getting an ECG done.
Yeah, yeah.
And or whether we make a referral for them to just see him. But it does sound like it's happening at rest, which isn't... Yeah, we do need to ask the question,
Yeah,
why is
absolutely.
that the case?
All right. So, we will write a letter to the powers that be about you snoring. And we will check in. The best thing to do is check out your heart, OK?
All right, then.
Fantastic.
Thanks very much.
No problem, thank you.
Bye-bye.
I'm Dr. Graham. How can I help?
We've been on holiday for 2 weeks, and while we was away, she was complaining her ears were hurting.
Yeah.
I had an audiology appointment with her today.
Yeah.
So we went down there, and he said that her right ear is blocked.
Yeah.
And the left ear, it looks like something going on infection-wise.
Right.
And he says that I needed to come and see you.
And do they hurt both ears at the moment?
Which ear hurts, Robin?
That one.
Yeah, the right ear.
Does it hurt if I press here? Does it hurt at the back? The ear canal is quite red and there's a bit of pus in there.
Right, OK.
So she might have had an infection behind the eardrum that's burst.
Right.
And then left some
Gunky
stuff in the
OK.
canal. Should we look in the other one? For you to stand up, I think it'll be easier for me to get around it that way.
Good girl.
And this one, if I press here, does that hurt? And that there? Nope, good. I would actually say that one looks pretty all right.
OK.
She needs to have some antibiotics for that side because that's an infection.
That's the side where she's got mild hearing loss in?
That side?
Yeah.
OK. Is she allergic to anything?
Not that I know of, no.
So we normally give amoxicillin, all right?
OK, yeah.
So this is 1 spoonful 3 times a day for 5 days. She should probably keep the ear dry, maybe for a couple of weeks till it's fully better. Is that all right?
Yeah, that's fine.
Good.
Who do I need to see about speech and language?
We could talk about it now if you want.
Yeah?
Yep.
She's very still learning to pronounce words.
Yeah.
So she can't say things like her brother's name is Jackson.
Yeah.
She says Jack's done.
Yeah.
So her development in school is perfect.
OK. Does the teacher have concerns
No, they
about
haven't
it at all?
said. No.
So it would be worth talking to them because
Okay.
there's a very wide range of normal, and a small problem like this, when everything else is fine,
Yeah.
will sometimes just improve with a bit of practice. But if the school is concerned and thinks that she might benefit from speech and language, then they might want to write a small report,
Right.
OK, to us. How does that sound?
Yeah, that's
Is that
fine.
all right? Because it
That's all right.
sounds like otherwise she's doing really well, and at her age it's all right to get quite a few things slightly wrong.
Yeah.
Is that OK? Good.
Right, say bye. Say thank you, Dr. Graham.
Bye.
Bye.
Hello.
Hiya.
Hello. Very good. So it is. Are you Cody?
Yeah.
Cody, who's this?
Mummy.
Mummy. Very good.
I brought him in a few months ago because his willy didn't seem to be growing with him.
It doesn't.
No, it doesn't seem to be growing at all.
No, it won't grow until he's about 11.
All right, OK. But he's been complaining it hurts quite a lot.
That's different.
And also his bum is also red raw.
Does he scratch it?
He's always irritating him, yeah. But he's just, for the last 3 days now, he's been complaining that his winky hurts. He calls it his winky.
Cody, what I want to do, please, is to have a look at your bum and your winky. Is that all right?
Yeah.
So now you take your trousers off. All right. OK. Now, well, what I want to do, sweetie, I'm going to put you up on the bed because it's going to be easier for me. Here we go. All right. So first of all, we're going to look at your bum. Oh, he's scratching here and here.
Yeah, it's all around here as
He's
well.
very dry, so actually I'll give you something to put on there.
OK.
Where does your winky hurt? Can you show me? It's a bit tight.
OK.
That penis is perfectly all right for size
Right, OK,
at
yeah.
his age.
Good boy, do you want to get your shoes on?
Careful, careful. Not my... Those are my keys.
Cody, can we get your shoes on?
Sorry.
So that's very nice of you to say sorry. Thank you. Where am I going to sit now?
Nothing.
I was going to give him some steroid for that skin, but actually what I'd like to do is just some moisturiser. It just feels dry.
Yeah.
And if you put some moisturiser, it may just make the itching go away.
Okay, yeah.
I'm going to be a doctor.
Well, I hope you have somewhere to sit when you're a doctor. You can use this as much as you want, so I would put it on 2 or 3 times a day.
Okay, lovely. Come on then. Are you taking your picture? Right, say thank you.
All right. Bye-bye.
Right, thank you. Say bye-bye then.
Bye-bye.
Bye-bye.
Thank you.
Right then, so it's his 1 year IMS today. Yeah. And he's going to have 4 injections, all right? A booster of his hib, but also with the meningitis C. And then the new one, the MMR, so the mumps, measles and rubella, okay? Yeah. So it's a live vaccine. 24, 48 hours, may get a bit of a temperature, maybe just a bit off, you know? Yeah. You can't do anything right, you know? Not allergic to anything that you know of?
No.
Yeah, lovely.
You're going to be a big boy, aren't you?
Yeah, it's going to go in his legs, so 2 in each leg, obviously. Because he's nice, big and strong now. We'll have to keep a hold of him because he's going to get really...
I've got 2 others, so I've got a 5-year-old and a 4-year-old.
So you know how they get?
Yeah. The eldest was the biggest problem. He screamed every time he had one.
It wasn't me, was it? No, I've only been here 5 years, so it wouldn't have been me.
And then I bought the middle one for his preschool jabs like 6 months ago, whenever it was.
Yeah.
And he sat and he smiled.
Oh, well, there you go.
I think the nurse was quite amused. Ready? Hold Mummy's hand then. Okay?
Yeah. All right, Mummy, ready?
Let me see it. Good boy. Well done. Good boy.
Is that one?
Well done. You're so brave. Okay, well done. Good boy.
Okay.
Well done. I know.
All right. You've got hold. We're going to go Men B now.
Good boy. Well done.
Plaster, plaster, plaster.
Good boy.
Right, turn around, next leg.
Just get it done. Just get it all done. Hey, you're fine. You're fine. You're with Mummy.
Ready?
Yeah. Good boy. Good boy. Good boy. 1 second and then we'll all be done.
1 more to go. Doing well, doing well.
1 more second, sweetheart. Good boy. Mummy's got you. Good boy. I know.
All done, all done.
That's it. Good boy.
Well done. Well done.
Good boy.
Oh, so sorry.
Good boy. He's fine now.
Is he all right?
Yeah, he's such a happy little man. He's a good boy. Aren't you? You might have earned yourself a biscuit when we get home.
Nice.
Have a cup of tea and a biscuit.
Does he drink tea, does he?
Loves it.
Right, so that's everything written up. And I won't see him until he's 3 years and 4 months. Yeah, I'll get the door for you.
Thank you. Come in there, precious.
All right, well,
Good boy. You're going to say ta-ta? Ta-ta.
bye-bye. Take care. Bye.
Thank you.
You okay?
Yes, thank you.
Oh, right. What we have is... I'm assuming it's this foot. I always forget which foot it is. He stubbed his toe.
Yep.
Basically, he has... It's not that one. It's the other. I knew it. 50-50 chance to get it wrong. Right, so he stubbed it about 2 weeks ago. His toe is really quite...
Yeah. It's a little bit sore, isn't it?
It's definitely not sore today, but what I don't like is the fact this doesn't seem to be connected to his nail anymore.
How do you mean?
It's all... yeah.
This is all red and pussy, isn't it? That's the bit
This
that
is
bothers me.
It's not right.
How long ago did you say it happened?
About 2 weeks.
2 weeks. I think he probably just needs a very short, sharp course of some antibiotics.
Okay.
Just to settle that down.
Yeah, no worries. That's what I thought. As soon as it started going red, I was like,
Yes. Yeah.
I know, sore toe, I know.
So I'm just going to give him the minimum he needs, which is going to be 2.5 mils 4 times a day. So it's a tiny-ish amount that he's going to need. Not stopping you walking.
That's the problem. Nothing really affects him. He just takes stuff in his stride.
Oh, not the bin, though.
No, can you knock the bin, please?
Not the bin.
So now he's like, I definitely want to get in the bin.
Yeah.
Come on, Right.
OK.
Let's say bye, bye, bye.
Bye.
Thank you.